Hi everybody, I'm Attorney General Aaron Ford and I'm here at Carson, Tahoe Regional Medical Center. I'm about to get my second dose of the coronavirus vaccine, the Moderna vaccine, and just want to remind everybody that these vaccines work hand in hand with your immune system to ensure that you can fight off the COVID virus should you be exposed.
Good afternoon.
Hi.
My name's Valerie.
Hi, Nurse Valerie.
I'm one of the RNs on the vaccination team here at Carson, Tahoe, and I understand you need your second dose of the Moderna vaccine.
I do, and thank you so much, Nurse.
You brought a card for me so I can just clarify that you had Moderna.
Yes, ma'am.
All righty. And how did you do with your first vaccine?
I did fine. I had a sore arm for the night, but beyond that, no other problems.
All righty. Well, let's hope for more of the same.
I do. And let me say, Nurse Valerie, thank you so much for your work on this. As a member of law enforcement, I want to say on behalf of law enforcement, we appreciate you putting your life on the line for us on a daily basis. And thank you for administering this vaccine for us.
Thank you. It's my privilege, and the front line here has worked hard to get us to where we are today.
Yes, ma'am.
So just got to do a little prep work here, and
Okay.
we'll be ready to roll. And you actually get the same dose each time, so there shouldn't be too much different from the first dose to the second dose.
Very good.
Alrighty, ready?
Yes, ma'am.
Okay, just relax that arm for me.
Okay.
Here we go. 1, 2, 3.
When are you going to start it?
I'm all done.
You're finished?
I'm all done.
That was fantastic. Thank you so
Alrighty.
much.
I'm not going to put a Band-Aid on your skin because you're not bleeding.
Okay.
Alrighty.
Thank you so much.
Have a wonderful rest of your day. I'm going to fill out your card here, and then it'll be your permanent record.
Thank you so much. And thanks again for all your work.
You're very welcome.
Very good. Well, now that I've had my vaccine, the requirement is that you sit for 10 to 15 minutes just to ensure there aren't any adverse effects. And the first time I had my vaccine, I sat there and had no problems at all. But this time I get to have a conversation. And I get to have a conversation with Dr. Jason Collins. He's here to help us learn more about the vaccine. And so with that, Dr. Collins, would you care to introduce yourself, please?
Thank you. Very nice to talk to you today. I'm Dr. Jason Collins. I'm on staff here at Carson Tahoe Regional Medical Center, and happy to be here. I am a gastroenterologist here in the community. I've been here for about 2.5 years. I actually received my Moderna vaccine here about 1 week ago.
Oh,
so
great.
I received both doses a month apart, and was quite happy to finally get that done.
Yeah.
I've been in the area for about 2.5 years. I moved from Colorado. Grew up in Chicago on the south side.
Wow.
And I went to the University of Michigan for undergrad.
The University of Michigan.
Well, the people from Ohio State always call it the Ohio
Because we are
State.
the Ohio State University. Y'all picked up on this? You listen to them.
And then I went to University of Illinois for medical school and residency, and then went to Howard University for my gastroenterology fellowship.
Wow.
So it's been a long route to get here, and enjoying Reno.
Well, we're so glad that you are here with us. There's a lot of overlap, actually, and we need to be careful because folks are going to get us confused. You have green eyes and a bald head, kind of like I do. And so we should ensure people know I'm Attorney General Ford, and that's the dude who went to Michigan.
Dr. Jason Collins.
Yeah, that's the dude who went to Michigan. Now, you said you're from Colorado originally, is that right?
I'm from Chicago, actually.
Chicago, but you were in Colorado. My son went to school at the University of Colorado at Boulder, nice. And he's a medical student, as I indicated to you earlier, so we got a lot in common there. Thanks again for being willing to talk to us about this. Let me ask you a quick question that I think is permeating throughout the community. Is the vaccine safe?
So is the vaccine safe? I'll preface this with saying I'm not an infectious disease doc, but obviously I've done some reading about the vaccination. I've received it myself. I do think it's safe, and the data shows that it's safe. Any vaccine, of course, you can have side effects, etc., but the safety profile is very good. There have been very few severe reactions, that we've seen around the country, and it's something that I think is important to get moving forward.
Yeah, well, thank you for that, because there's a lot of trepidation in the communities, and predominantly in some of the minority communities, we have a lot of trepidation. And so I wanted to make it a point to advertise the fact that I'm getting it, and I'm glad to see you as an African-American doctor has likewise gotten it. The only side effect that I've experienced since the first time I had the shot was a sore arm. I really had a hard time sleeping on it that first night, but beyond that, I've had no other side effects. Could you talk a little bit about the side effects that the vaccine may have?
Absolutely. So some of the listed side effects that we've seen, obviously with the injection itself, you can have soreness, redness, maybe even some swelling at the injection site. That usually will go away within 2 to 3 days. Sometimes you do have symptoms that develop, within about 12 to 24 hours. They may be more, we call them constitutional symptoms. They may involve the whole body. Some patients may describe a low-grade temperature, body aches, some chills, and maybe fatigue. And so those are the main side effects that we're seeing. Of course, there have been a few cases where people have had more serious reactions, but very few that I've heard of. But the vast majority of patients in the trials, as well as anecdotally from me talking to my coworkers and friends, the vast majority of people have done really well. I definitely had side effects. I actually took Advil a couple of times. The first time I had a pain in my arm, I thought I had worked out that morning and realized it wasn't a workout, it was a vaccine.
Well, I wouldn't have made that mistake because I don't work out, but I would have known I needed Advil.
So it took about 2 days for the soreness to wear off. And I actually I experienced the fatigue as well. Okay. And I actually took a nap for about the first time in 10 years.
There you go.
The day after I got it.
So that's a great side effect, taking a nap? I mean, come on.
But other than that, it was really easy. For me, it was on par with getting the flu vaccine, which I do every year.
Which is actually a great segue to my next question. Can the flu vaccine stop COVID?
Okay, so no. Unfortunately, right? The flu vaccine doesn't stop it. They're two totally different viruses, and you need a specific vaccine depending on which virus you are targeting at that time.
Good, because we know there's a lot of misinformation out there, and we want to try to dispel some of those myths, and so thank you for that answer. Another question that I hear prevalent in the community is whether booster doses or annual vaccines are going to be needed after this particular shot.
Yeah, that's a very good question. At this time, I don't think anyone knows for sure. Obviously, on some level, the 28-day shot, 28 days after the first shot, that's a type of booster to get the immune system revved up, if you will, as much as we need it. That's necessary as a booster, but we don't know if there'll be a booster that's needed 6 months down the road, a year down the road. I'm sure that data will come out. We're seeing new data every month, from the CDC and from the different companies who are producing vaccines.
Great, great. Well, thanks for that. I mean, we've heard a lot about ways in which we can stop the spread, or at least slow the spread of the virus, from washing your hands to staying as far apart as you can and wearing masks. What other ways are there to prevent the spread of the COVID-19 virus?
I see. I think what you mentioned are some of the most important things. We know that the virus can, move between individuals. How does that happen, and what can you do to prevent that? Washing hands is huge. We want to keep our hands clean. Wearing a mask has been shown to be effective on some level as well. There's lots of discussion that's going on which type of mask. And obviously, we can't get into that today. That's a long lecture. But what type of mask is more important? And the jury's out on that. I know in our office, for example, we'll wear certain N95 type respirator masks to prevent us from, or to protect us as much as possible, given that we're doing procedures in our close proximity to patients. Our staff all around the hospital and in our clinics, they wear masks, all the time. Hand washing. I've never seen so much, gel in my life. But it's awesome, because it also spills over to everything else. So we've seen that it's helping, right, to prevent the spread in certain areas when we adhere to those guidelines. But if you look at the numbers for the flu this season, the flu numbers are down as well. And I think a lot of that has to do with there's more hand washing, there's more social distancing, there's more mask wearing, and it's paying off on some level.
Yeah. Well, thanks again. I have one last question for you, and I'd like that you look right into the camera and speak to our minority communities. Listen, when I got the first shot, I went to media and I took pictures of it. We put a press statement out. As an African-American male, I understand the trepidations, particularly in the black community, and wanted to try to relay some of those concerns. I even got creative in my fraternity is Kappa Alpha Psi, and I did a caning routine trying to encourage folks to do it. Some folks didn't understand what I was doing, but those who were the intended audience knew exactly what I was doing. And I was trying to lower some of the trepidation in the community around this virus. Is there anything you can say to the minority population out there to help them understand this virus and convince them to take it? And I'd ask you to look right into the screen on that.
Oh, okay, great. So, I mean, that's a very good question. It's an important topic in general. How do we improve compliance? How do we get more people to get on board with vaccination? I actually felt moved to get involved in a vaccination trial early on. Unfortunately, I couldn't. I actually tried to sign up for the trials before they even came out, but unfortunately it would have involved a significant amount of driving back and forth, and I just couldn't fit it into my schedule. I do understand the trepidation. I have family members, I have friends. Many of them have expressed hesitancy in getting the vaccination. The reasons I've heard are, I think, reasonable on some level. They're reasons like, we don't know what's in the vaccine. This came out so fast, how can we even know? I think to address that concern, I think we have to understand, it's kind of hard because even with my degree in cellular molecular biology, I have to look up some of the things that I might see in an article. But we have to understand that even though the vaccine for COVID came out so quickly, the technology to get to that point is something that's been studied for so many years.
That's what I heard.
So it's the culmination of so many scientists working on this issue to make sure that we can get here this quickly. So that's one thing. Even though this particular vaccine is new, the science behind mRNA vaccinations is something that's been being worked on for years. Some other things I've heard, of course, it was interesting. There was something on the news, and they're like, we're going to do a push to get the vaccine out to more African Americans and Latinos, and they're high need communities, so we're going to push it out to them first. I heard something like that.
Yeah.
And it was really interesting because I had some friends and they were like, you see this? They haven't done it on enough people, so they're going to try it on black people first. It's like, wait a minute, that's not exactly what's happening. They're recognizing, I forgot which community it was in, like they're recognizing a need on some level. When you look at socioeconomics, we see that people of any ethnicity, people from lower socioeconomic backgrounds have less access to health care, they have less access, to doctors, less access to the knowledge on what's going on, and in addition, they're working, they're on the front lines, actually in certain jobs where you're exposed all the time. And so, there's some trepidation, like, well, should I get this vaccine? And is it prime time, or should we let other people, get it first and see what the side effects are? The trials were done on tens of thousands of people. There have been multiple companies that have done trials, and the numbers are really good. I mean, when you see an efficacy rate of 94.1%, once you've received 2 doses for prevention, that's a big deal. And knowing that our community, people from lower socioeconomic backgrounds in general are more exposed because of the nature of their work. When you're working day to day with the public and you don't have the luxury of working behind a computer at home, you're more exposed, and getting the vaccine will protect you. We've seen the numbers. People definitely die from this. It's a serious, it's a serious virus, and getting the vaccine can help protect us, as individuals, and also our loved ones. So,
yeah,
well, if that answered it,
absolutely.
There's so much we could talk about this for a long
time. And I really appreciate you, willing to talk about this. Your medical expertise is obviously very helpful in this area, and Thank you for leading by example. I mean, mentioning the fact that you actually wanted to participate in the trial, I think should also should be given credence for what it is, and that's you showing your willingness to, again, reduce the trepidation in society. So thank you again for being here with us. And I just want to reiterate to everyone out there, if you can, get this vaccine. Please get in line and stay safe and stay strong, Nevada.